Welcome to the SANZSHO. This is Tori Sands, and of course we're joined here with Charles Too Tall Lyons.
That's right.
We've also got Detroit's Don Divo.
What's up, bitches?
We've got Tezzie Johnson. All right. We've also got Geronimo and
Trey.
We've got Cliff. What's up, Cliff?
Birthday boy. Why do you think he just missed America over there now?
Mariah.
Okay.
Hey, no, she did just give me the skank look.
She gave me that V-nut look.
That is a mess. Okay, so we got an email here. Y'all are a mess. We got an email from actually this person didn't even leave a name, so I'm gonna read this email. So
we gonna call him Nicholas in Detroit.
Maybe after I read this here.
Wow.
Okay. Okay. It says a friend of mine just confided in me that he's been having chronic diarrhea for close to 2 weeks.
Damn.
Sounds like HIV to me, or could I be wrong? I know the only way to be sure is to take a test, but what else could be the cause of chronic diarrhea? And also, is it too early to be showing symptoms only a week and a half after unprotected sex?
White Castle.
Cancer, White Castle, diarrhea.
Yeah.
I'm not
Stomach
boiled milk.
White Castle. Yeah, you said
lactose intolerant.
You said a week after having.
My sister tried to take me to White Castle today.
Maybe you second laxatives.
They say that it takes after 3 months after unprotected sex, you know, it will show or something like that. That's what I know.
But it could be 3 months to 2 years.
Truthfully, it depends on the person's body.
But honestly,
they can show symptoms within a couple of days. They can still show symptoms within a couple of days, all the way down to a year. You know what I'm saying? Like it depends on the person's immune system.
Yeah.
Right. So it's like a lot of people go get tested the day after they get fucked raw.
That's not gonna show nothing.
And shit gonna show. Now you going around fucking people, not knowing nothing. And now you infected because you're thinking that you really not infected. But still, at the same time, you're affecting more people, and y'all all do the same thing.
So basically, educate yourself about when and what time in your day.
The window period, you gotta educate yourself.
Okay,
but first off, I mean, just know this, just to answer his question, if your friend has diarrhea for 2 weeks, like Tezzie was saying, it can be any number of things. Now, I know people that are on HIV medication, and that's some of the side effects from the medication. Or they have diarrhea.
Right.
But if he had unprotected 2.5 weeks ago or a week and a half ago, whatever it was, I mean, he's just not going to have diarrhea from HIV.
He didn't have any symptoms.
It could be even full of colitis.
I mean, HIV does not give you diarrhea. Okay.
Right.
Okay. Well, you know what? Let's talk about some of the myths. I don't know, Tez, you got any myths? Okay, so Tez is going to tell us some myths here.
I don't need to worry about becoming HIV positive. New drugs will keep me well.
That's a myth.
I got another myth.
So I understand that now.
Well, let's defeat the myth.
How do you feel about
there are less pills that they have to take out, know about.
But there's sometimes
depending on your body chemistry and your immune system.
And also, it's like, depends on what strand of HIV. Now, if you were infected by someone that's already taking medication, that most likely that medication is not going to work for you.
Oh, because the virus has become immune to it.
Yeah, so when it's passed on to you, it's already like,
And they have to fight harder to fight.
So then you're going to have to do different combinations and everything else. So just because, there are like, medications out there that can like, make it a treatable, virus or whatever, don't count on it. I mean, because there's people that I've known who have, like, gotten HIV positive and died of full-blown, or complications with full-blown AIDS within a year.
But a lot of straight people feel like they can't get HIV. So, like, another myth was, like, I'm straight.
Just say straight.
I don't use IV drugs. So, I won't become HIV positive.
But if you're receiving oral sex, anal sex.
But, it's always what I was taught. The larger the pink part, which is like your asshole or the tip of your penis, pink part, we call it the pink part. The larger your pink part, the more at risk you are for HIV.
Really?
Because that's your tissue.
That's what
But wait a minute, vagina's larger than anus?
Right. Because, but for somebody to give it to somebody through their penis, it's not saying that it don't happen. It happens.
No, it happens.
But it's not as much as
there's no such thing as
vagina or asshole.
Your penis secretes.
Your
penis is for secretion.
And there's things that go down the tube.
You have secretion of bodily fluids. Your bodily fluids have constituents of the body like blood and other hormones and chemicals and stuff. So you're going to have your virus part of yourself inside your secretion.
Right.
So it's without saying, if you're giving somebody oral sex or you have an anal sex or vaginal sex with the penis going in there unprotected, you're opening yourself up for that.
Okay, can I ask you guys this? What's the difference between somebody that's cut and uncut? Is it more of a risk for somebody that's uncut to trans?
It's just
I can speak for that.
whole bunch of too much skin in there.
Somebody who's uncut, truthfully, are at higher risk for someone who is cut. Truthfully, because of the simple fact that they're not cut. Because actually, the circumcision, with the cutness, you got the extra meat, the extra skin, it gets in it, it sits, and all the other stuff. It can get inside of it.
This is the uncut.
This is uncut.
Okay, so wait.
But that's why they encourage circumcision.
Okay, let me ask you this. Okay, so a person that's uncut, if they're dating somebody that's positive, is it more of a risk for them to get it, or is it more of a risk for them to transmit it?
It's more of a risk. It's always a risk to transmit.
Okay.
So if a person is
regardless of you're positive, cut or uncut, it's always a risk to transmit.
I got a question.
Okay.
It's always a risk to transmit.
If you fall in love with a person that is positive, is it wise to date that person because you didn't know they was positive until they told you, but.
But why would you stop dating them because they're positive?
I'm just asking a question.
Because my thing is you know what I have learned that. Like people who are positive, they can get dates because people who don't like using condoms don't want to date them.
Right.
It's never because that they want to use condoms. That they want to use condoms. If they want to use condoms, if they don't want to protect them, they want to protect themselves. They will use condoms if they want to protect themselves.
I gotta know that.
You're saying if you're the type of person that can stick with using protection, then it's a situation that can progress to something else. You can stay with that person.
I would stay with that person.
Of course.
Why would I want to stop dating someone because they're HIV positive? It's stupid. First of all, gay men are at the highest rate.
I'm talking about the
as far as people being infected.
The world who like me growing up, I was like, I would view them or distance myself from a person like that, but now like I'm mature to understand the lifestyle and whatnot.
But why would you
I'm gonna say this because I'm trying a happy medium right now between the two of y'all because I feel what he's saying and I feel what you're saying. Me personally, as long as I'm protecting myself, I can't discriminate against a person with HIV. That's like a white person discriminating against me because I'm black. Basically, it's nothing that I can do about it. It's nothing they can do about it. So my thing is, as long as I'm protecting myself, even if I do wind up with it, okay, I wouldn't want nobody. It's always a chance. It's always a chance. You can't treat nobody else different because it can always be you. It can always be you.
Yeah. Because even if somebody who doesn't have it, you end up getting in a relationship with them, then y'all both find out y'all negative. You know what I'm saying?
That's up to you.
You end up fucking with somebody who does, and he's positive, and you come back home, trees. You know what I'm saying? Then somebody end up coming back home, and then you end up fucking your boyfriend after fucking somebody else, and you infecting him. Y'all gonna get tested. Y'all both end up negative because y'all still within the window period. And the next thing you know, y'all both walking around still fucking like rabbits. Now y'all in the club arguing because y'all don't know who infected who, and now y'all throwing bricks for each other.
Touch on people who've been in
true story.
That's
true story. But still, that's just crazy.
There's people out there who've been in relationships for a long time who, after a certain period, bring in other people to mix it up and change it up. And
still late.
Fuck all that.
That's a completely different.
I'm selfish as shit.
That's a completely different subject. It's not even just gay people. Straight people do that too.
Yeah.
But it's not.
You call them swing.
Either way it goes. I understand what you're saying. Either way it goes, it's not right, in my opinion.
Yeah.
I think people should be monogamous anyways. But if you do that, that's your own choice.
Can't we all be monogamous?
But what we're gonna do?
Because monogamy is not necessarily the ultimate.
I'm talking about all of us. Can't we all be monogamous?
Well, look. Why? We gotta take a break. We're gonna wrap this up right quick. We'll come back. We're gonna continue this conversation, and then we're gonna do something else before we get out of here. So we'll be right back. We'll talk more. You guys leave your comments underneath this video. Let us know what you think about it, and we'll be right back here at the Sand Show.